This is a presentation on the Rorschach Inkblot test by Chelsea Norris for Colorado Christian University. To understand the Rorschach Inkblot test, you must first understand its history. The test was developed by Herman Rorschach in 1921. He splattered ink onto paper, then folded the pages in half. This created symmetrical images. Herman then chose 10 cards, which he utilized in his therapy sessions with his clients. Herman then died in 1922, and his test gained popularity. By 1959, the Rorschach Inkblot test had become the most frequently used test by clinicians. It was believed that the inkblots brought out the unconscious mind of the client. And while this test is still widely used today, it has gathered scrutiny and criticism. The Rorschach Inkblot test is now classified as a projective test. This is due to the ambiguous nature of the test. The Rorschach Inkblot test is administered by presenting the client with 10 cards, one at a time. The client is then asked about what they see in the cards. The clinician then scores their responses. The 10 cards used in the Inkblot test are the same 10 that were designed and implemented by Herman Rorschach himself. However, these images have been altered due to a printing error that occurred during Herman's creation of the Rorschach Inkblot test. Others have created their own cards, and several countries have invented their own versions of cards. These countries have also developed their own methods of interpretation. Despite these other versions, the Rorschach Inkblot test is still the most commonly used worldwide. As mentioned before, the Rorschach Inkblot test is administered by showing the client 10 cards, one by one, and asking what they see. These answers are then interpreted for scoring. When scoring this test, there are 3 main components. These components are location, determinants or descriptions, and content. These components each have their own categories to obtain accurate assessment. The content component of the Rorschach Inkblot test has 22 scoring categories of its own. Despite the original scoring method of the Rorschach Inkblot test, there are many schools of thought on its interpretation and several other versions of scoring for the test. Some believe that this test should be scored nomothetically. Others believe in ideographic interpretation. There is also controversy about the administration and scoring of this test within theoretical practices. There are those that believe that the Rorschach Inkblot test should be designed and administered atheoretically for more diverse use. Others believe in utilizing the test within their own theory or within the theory it was originally designed under. Still others are more moderate in combining the two options. One current popular method of scoring and interpretation can be found in the contemporary Rorschach interpretation. Every test has its strengths and weaknesses. The Rorschach Inkblot test is no different. Several of the test strengths include ease of administration, adaptability of the test to assess many disorders, and this test has stood the test of time. After almost a century, the Rorschach Inkblot test is still widely used. The main weaknesses of the test lie in its scoring. The Rorschach Inkblot test is difficult to score, and there is also controversy around the scoring due to different schools of thought about interpretation and theoretical method, which have already been discussed. As stated in the last slide, the Rorschach Inkblot test has become controversial. One reason has been previously mentioned about the theories and interpretations in scoring, but there are other factors. One being the fact that this test requires extensive training. Some argue that this training is not always provided or taken before the administration of this assessment with clients. Other controversies stem from the validity of this exam. The validity of the test is questioned for several reasons. The newest reason being that the 10 images used in this assessment can be found online. This means that individuals may see the images, which can possibly alter their perception. The test is also questioned because of the variety of scoring methods being utilized in the mental health fields. The Rorschach Inkblot test may have a variety of scoring methods, but the original version has a variety of applications. This assessment can be used to assess those with psychotic disorders, anxiety disorders, personality disorders, depression, and more. This test can also be used to assess behaviors, such as the level of aggression in adolescence. Due to the projective nature of this test, it has nearly countless uses. The Rorschach Inkblot test was developed by Hermann Rorschach, and he ascribed to the psychoanalytic method. The test was designed to access the unconscious mind of the client. This assessment has since been adapted and utilized with other methods of therapy. Existential therapy is one example. Others have developed an atheoretical version, and this development is believed by its creators to be more versatile for clinicians, as well as more culturally competent. In conclusion, the Rorschach Inkblot test is a wonderful option for the trained clinician. However, I was surprised to learn that this assessment is under scrutiny due to its images on the internet. Clinicians will have to be alert and on guard for other issues that may arise in assessments in this technical age. Despite my research, I was never entirely sure what this scoring exactly entailed, or how many versions are available. Counselors wanting to administer the Rorschach test truly do need extensive training in order to properly administer and understand this assessment. During my research, I often thought of Psalm 139, as this projective assessment is meant to unearth the unconscious. Psalm 139, 3-4 says, "You search out my path and my lying down, and are acquainted with all my ways. Even before a word is on my tongue, behold, O Lord, you know it altogether." That's the English Standard Version. God already knows our unconscious, our minds, and our hearts, and counselors can utilize the Holy Spirit to access this, both for themselves out of session and their clients in session.